What's up, everybody? Long time no see. It's been a while since I posted a video. If you guys are new here, my name is Simone. I post videos kind of at a weird time. I don't have a consistent schedule right now, but I'm working on that. And I come to you from my bedroom in the midst of COVID-19, where we're doing our social distancing and doing our part, to talk to you guys about my nursing school experience. A viewer reach out and leave a comment in one of my last videos asking for me to do a video all about my nursing school experience. So I reached out to some of my friends, one that's in my same cohort and one that is in a different college, and asked them what they wish they knew before they going into nursing school. And I also want to answer my viewers' question. So I have a list on my phone and let's get into it. Okay. So first of all, I have written on here manual blood pressure. So in a past video a while ago, someone had commented, you should do a video about manual blood pressure. If you guys are interested in that, let me know and I can do that for you. But moving on is experience and what is it like? So nursing school is crazy. You know, it can be very overwhelming. It can be heavily filled with anxiety sometimes. But nursing school is awesome. You get to learn to do so many cool things. Like you get to give injections, you get to take blood pressure, you get to, you know, go into surgeries, you get to do all these different things, you get to go into the cath lab, you get to do all these fun and exciting things that medical professionals get to do that like non-medical professionals are like, what are you even talking about? And like you get to learn this new fancy like medical jargon language that other people don't understand, and you sound really, really cool when you're talking with all of your friends and you're talking about like the things you saw and the things you did, and everybody's like, what are you talking about, you know? But honestly, nursing school, my experience was I in the beginning stressed myself out a lot about grades, and I had to realize that me taking 30 minutes to an hour to do something good for me, self-care, something I love, videos, working out, cooking, coloring, whatever it is that you love to do, make time to do that, because 30 minutes to an hour is not going to change whether you got an A. Trust me. If you're going to get an A, you're going to get an A. The 30 minutes to an hour that you take each day to do something for yourself is not going to change that, and it's not going to change your GPA. It's going to help you do better. It's going to make you feel less trapped. Like when you're sitting there studying, like, I have to study all day long. Like you just want to like burst. You just want to be like, I don't want to do this anymore. But you have to take time for yourself. Leading into that, I think the next question or the next point was how to do well. And that is a very broad topic. I'm hesitant to talk about this because I struggled really hard with finding a way to study for myself. And I would be like, oh my gosh, this is in my prerequisites. This person did really well. Like I should study the way they study and I'll do that well. No, it doesn't work like that. You have to figure out what works best for you. You have to study your way. You need to, if you're a book reader, read books. If you're into, or the textbooks, if you're into the PowerPoints, do that. If you need to take practice tests, because that's what works best for you, do what works best for you. And I'm a firm believer in that. I graduated summa cum laude. I'm so excited about that. And that's what I had to learn, is that do not feel guilty about not studying. Take time for yourself. Self-care is so important, and figure out a way that works best for you for studying. Do not try to, I mean, you might study the same way as somebody else, but don't just try to adopt or adapt someone else's way of studying. You have to find what works best for you, because the way someone else studies does not always mean that it's going to equal out the same thing for you. And that's my biggest thing. That's my biggest tip. That, I mean, I was in tears one time because my dad stopped at Wendy's on the way home, and I was like, I need to be studying. I can't be at Wendy's right now. And I was crying to my best friend about it. So it's just taking time to realize that going to Wendy's, eating dinner, working out, whatever it is that you like to do or you enjoy, taking some time for yourself is not going to change how you do. You're gonna do great. If you apply yourself, if you take time for yourself, if you study and you work hard and you take care of yourself, because you can't take care of somebody else if you're not taking care of yourself first. And that is the ticket. That is the golden ticket. You just have to find a balance, and that can be really hard. And I struggled with that too. So you just have to remind yourself, I am smart. I can do this. I got this. And I'm going to take this little bit of time for myself. I used to feel so guilty with Netflix and all that stuff. But you just have to learn to be okay. You have to take time for yourself. That's normal. And you're still going to do great. Everybody's going to do fine. The next one is, I guess, I want to touch a little bit more on the experience. So like, you get to go into clinicals. You get to, see so much. You see babies being born to long-term care facilities. Not a lot of people can say that. I mean, you get to see all aspects of life, the circle of life. You get to see so many different things, and that is very touching. And as a nurse, that is something so cool, that at least I think is cool, that you get to be a part of so many people's journey and so many people's lives, and you get to go do cool things and get to experience cool medical science awesomeness, innovative things, and watch as technology grows and changes and how healthcare changes. And that's super, super awesome. The next thing is, I talked about, next thing is confidence, is having confidence in yourself. Fake it till you make it, or practice, practice, practice. Actually, both. Just practice. I have this big teddy bear, and I used to stick a cup and practice Foley's with a teddy bear, or practice blood pressure on friends and family. Just practice, 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 and you hone in on your skills, and you can use that when you go in to see patients. Practice. It's scary the first time going into a patient's room. You're like, somebody come with me. I don't want to go in there alone. And then you realize it's just a person. And you're there to take care of them. Just talk to them. They're just a normal person. You go in, hi, my name is Simone. I'm going to be your student nurse today. How are you doing? How are you feeling? Can I get you anything? You know what I mean? It's scary at first, the first day, and then you look back on it and you're like, wow, like I go in there and I get my stuff done. And before, I was afraid to just go in and introduce myself, Just be confident in your skills and in yourself, and be happy and touch people's lives. Care for people the way that you would want to be cared for, or your family member to be cared for. Let's see. Fear of failure. So there is a lot of anxiety as a nursing student. Getting into nursing school is very competitive, and we're all, like I said, we're all used to doing well. And there's the fear, oh my gosh, what if I fail? I was one of those people. You could ask my friends, oh my gosh, I don't know anything, I'm gonna fail. And that didn't happen. So it's anxiety, but you know your stuff. If you study, if you take time for yourself, if you balance your life out and you do the best that you possibly can, that is all that anybody can ask for you or ask of you. And if you don't do well, there's resources to help you. No one wants to see you fail. Reach out to faculty, reach out to teachers, reach out to students, ask for tutoring, ask for library resources. Do what you have to do and take charge of your education, but they are there to help you, and take interest in those resources if you need it. And that's okay. They have things set in place. If you don't do well in this one class and you have to retake it, there are steps to help keep you on track or get you back on track. Listen, life happens, and sometimes we don't do well. And that's okay. And grades do not define you. Your grade does not make you a good nurse. It does not make you a bad nurse. A grade is in that moment in time, on that exam, how you did. But that does not define if you know that material, because you might know it and that day you just had an awful day, your hair day was bad, you had something going on with family or friends or a loved one, and it just didn't click for you in that moment at that time on that test, but that does not make you a bad nurse, and that does not make you a good nurse, because you can have all A's and not be a good nurse and not have good bedside manner and not have good patient care. But somebody who may struggle with grades is an amazing nurse. So grades do not define you, and don't let that stand in the way of your confidence in yourself. The next thing is kind of talked about being guilty. Don't feel guilty. Take time for yourself. Watch Netflix. Do what you love. Sit and do nothing. Take a nap. Do what you need to do to recenter yourself and take care of yourself. And the last thing is how I got into the program and my statistics. So my nursing school looked at, I think it was 3 things. It was the T's, your overall GPA, and your nursing GPA. Other schools will do an interview. Other schools will do an essay. But this is my personal experience. So I took the threes. I took the T's 3 different times. You can only take it 3 times in a calendar year, and you have to wait 30 days in between. I struggle with standardized testing. Like the T's, SAT, ACT, you know, I pass them, but I don't do above and beyond. So I struggled. I had to take the T's 3 times. I passed the first 2 times. I just wanted a more competitive score. My score was still not where I wanted it to be, but it was within like the range of what they were looking for at the time. I think it got like an 86 or an 85. And at minimum, to apply to my nursing school, you had to have a 79 just to apply. So I wish I had done better, but you know, I'm still here. I'm still standing. And that is just my story. I had an overall GPA of, I think it was like a 3.9, 3.8. And my nursing school GPA was, or my prerequisite GPA, I'm sorry, was a 4.0. So I got a B in college algebra, and I got a B plus in chemistry. And for the prerequisites, you could substitute chemistry for biology, and I got an A in biology. So that's what I did. And I got in, and it was very stressful and it was crazy, but I did it, and you can do it too. Believe in yourself, put the hard work in, care for yourself, and you will do great. You will succeed, and focus on you. Don't focus on anybody else and what they're doing. Focus on yourself, and you will succeed. I promise you, you will succeed. And yeah, I'm just trying to make sure I didn't miss anything. That's how I got into nursing school. If you have more specific questions, if I didn't touch on something that you wanted me to, oh, also that sound was my pop socket. So yeah. If there's something that I didn't mention, then please leave a comment down below. I will answer your questions. DM me on Instagram. I'm here for you guys, and thank you guys so much for watching. And please make sure to like and subscribe. I hope this helped you, and I will see you guys in the next video. Bye!